Well, I'm going to talk about burning mouth syndrome, also known as glossodynia, which I don't know if you're familiar with, but it's a condition characterized by a painful sensation of persistent burning in the oral cavity, experienced by people whose oral mucosa appears completely normal, with no signs of irritation, local inflammation, or ulcerative lesions upon examination. The etiopathogenesis is unknown. It is indeed multifactorial and may be due to nutritional, hormonal, hematological, rheumatological, neurological, hygienic, dietary, and also psychological factors. The epidemiology is highly variable. It can occur in about 2 to 5% of the general population. The average age is between 50 and 70 years, although it is also quite common in younger patients. It is more common in females, and in particular appears in perimenopausal patients. And the clinical presentation, as I mentioned earlier, mainly consists of burning, pain, and a burning sensation that can be felt on the tongue, lips, and palate. It can appear throughout the entire mouth. It can also be associated with a taste disturbance and may be temporary, as between 30% and 50% of patients improve spontaneously. On examination, as I mentioned before, no inflammation, ulcers, or atrophy are observed. However, xerostomia does appear, along with chapped lips, cheilitis, gum hypersensitivity with itching in the oral cavity. There may also be tingling, stickiness, or numbness of the tongue, and a rough palate or tongue coating. The etiology, as I mentioned earlier, is multifactorial. It may be due to vitamin deficiencies, diabetes, hypothyroidism, kidney failure, gastrointestinal, hematological, or autoimmune diseases such as Sjögren syndrome or lupus. Tumor processes, especially treatments associated with neoplasia such as chemotherapy or radiotherapy, oral candidiasis, lichen planus, and also medications such as antidepressants or ACE inhibitors, as well as intolerance to dental implants or prostheses, and also neuropathy. It's also worth mentioning that in 45% of cases, the disease has a psychogenic origin. And finally, the treatment is somewhat controversial. It is true that hygienic dietary measures should be implemented first. As I mentioned earlier, the use of lozenges, chewing gum, avoiding coffee and spicy substances, and first ruling out candidiasis or xerostomia. Then, the rest of the diseases should be considered, and finally, medical treatment, as it has been shown that both gabapentin and some antidepressants can be useful, because of the psychogenic component that the syndrome may have.